tonight we have a treat, Dr. Ruth McLarty. She is a general surgeon here at Howard Memorial. And how long have you been working here? 2.5 years. 2.5 years, okay. So yeah, she's always busy. I always see her name on the list all the day. But she's going to talk to us about gut health.
So I'm a general surgeon and a colorectal surgeon. And I just wanted to talk to you about some basics of colon and rectal health. So the colon is the large intestine, right? The small bowel is the small intestine. The right colon consists of the ascending, which is on the left up there, and the first part of the transverse colon. And then the left colon is the rest of the transverse colon, and the descending colon, the sigmoid colon. And then you have the rectum down there that they've got kind of purplish. The anal canal is actually short. They make it look long there. It's actually just the short opening to the rectum. The historically well-known function of the colon is to convert liquid stool into solid stool so that it's manageable. Just imagine if you had diarrhea every day, what that would be like. So you have absorption of water and electrolytes, and that's under control of the whole body. It's not just the colon. I mean, there are hormones and that kind of thing that control that. There are some nutrients that are taken out of the colon after everything's been broken down, and actually the breakdown process allows those nutrients to be there. Bacterial fermentation, and that sounds like a bad thing, right? That's one of the best functions of the colon. It turns out it's incredibly beneficial to us. It also, and we're going to talk more about that. The colon wall is also a protection of the host or the body from all this bacteria that's in the colon. There's a barrier. It has immune function. It affects metabolic function in the whole body. It synthesizes vitamins B and K. The anus and rectum really are storage and controlled evacuation of the feces. That's the function there. Works quite well for most people. The appendix, we know it as something that keeps surgeons busy, but it probably has some immune function and is a bacterial reservoir. The colon, like all tissue in the body, has a blood supply. These are arteries that are coming off the aorta, and you have branches that go to the right, the left, and then the transverse gets fed by both. On the right side of this screen, it's really hard to see here, but the blood vessels come in like a leash on the bowel, or an anchor for the bowel. It swings off the blood supply, and those little blood vessels go into the colon wall, and that will be important in the next slide. Just some common disorders. Diverticulosis, you've all heard of that, and people wonder what it is. It's little outpouchings of the bowel. It's like a weakness in a tire or a hernia in the body, and it is a wear and tear phenomenon. You're not born with it. And those little outpouchings tend to happen where the tiny blood vessels go into the colon wall. There's a weakness there. So they occur in all where the blood vessels are all going in. Now, when they get inflamed, you get diverticulitis. And on the bottom right, they're trying to paint that red, indicating it's inflamed. Like I say, this is acquired. It's thought to be largely due to Western diet, sedentary lifestyle, slow transit, constipation. And ideally, the stool, you want it to be like good, healthy garden soil. The right amount of peat moss, the right amount of sand and clay. You don't want it to be stiff like hard peanut butter or that kind of thing. It needs to have bulk to it, but it needs to be just right. Irritable bowel syndrome is crampy abdominal pain, alternating constipation and diarrhea. Most people have a predominance of one or the other. And I can't tell you much about that. There are lots being, it used to be just a diagnosis of we don't know what's going on. A lot more is known about it, but that's a medical disease, and so I can't tell you an awful lot. The gastroenterologist been studying that for years. Inflammatory bowel disease, IBD, which is often confused with IBS, is, like it says, inflammation, and it's in the Crohn's colitis family. And that's something that you can see, you can biopsy, you can do blood tests for. There are other colitises like infection, diarrhea from travel and all sorts of things like that. Antibiotics can cause a colitis, altering the bacteria in the colon. Or ischemic, when the blood supply that I showed you before gets lost, one of those branches gets blocked. Constipation, a very common problem. We could go on and talk about that for a long time. Diarrhea, many causes. Polyps. Now these are little precancerous growths. Often they're no bigger than a freckle. They can be the size of a mole. And they can be removed through a colonoscope, and that's what's called primary prevention of cancer. There's been no cancer at all. You're nipping off a precancerous polyp, and almost all colon cancer, almost all of it, started with a non-cancerous polyp that could have been nipped off. And so when people say, I don't want to know, yeah, you do. It's just like going to the dermatologist. They check you over, they say, well, we better freeze this, we better burn this, we better biopsy this, and they keep your skin intact. They don't want anything to happen. They say, well, we better freeze it, because if we leave it, it might grow into something. Same thing. Some of the anorectal disorders, hemorrhoids, most common. And, to a colorectal surgeon, when somebody says I have hemorrhoids, you don't know what they really have. It may be hemorrhoids, that's very, very common, but it often means I've got a problem in the anal area. Hemorrhoids, hemorrhoidal tissue is normal. It's part of our anatomy. It's like a washer on a faucet. It's part of the closing mechanism. But the blood vessels, which the little blue dots are blood vessels, they get congested. Those are veins. They get congested and swollen, and they can be internal, which are painless, but they can prolapse or stick out, and they can bleed. The ones on the outside, those can be painful, or they can just create a hygiene problem. Fissures are cracks or tears. They usually start with a hard bowel movement, but once they're there, they create intense pain and spasm. And then instead of relaxation, there's tension when you try to have a bowel movement, more tearing, more spasm, more pain, and that can be a major problem. And that's something we commonly treat. An abscess occurs, and the abscess is on the far right. When there are little glands inside the anal canal, and everybody has them. It's there so that you can have a bowel movement normally without a problem, but they can get infected and form an abscess. After the abscess is dried, has drained and healed, you can be left with a tract, which on the left side of that right-handed picture is a fistula or a tract. And it's from where those anal glands were inside the anal canal to where that abscess used to be. And those things sometimes will never heal without surgery. Pruritus is just itching or irritation of the anal area, many, many causes, and a nuisance, a major problem. Incontinence can vary in degrees. It can be just to gas, or it can be to gas and liquid stool, or it can be to everything. Bleeding, that can be from colitis, from cancer, from hemorrhoids probably being the most common. Warts, the human wart virus is responsible for almost all anal cancer, almost all cervical cancer, and a lot of pharyngeal cancer. And people don't realize that, but many people get warts. The warts are treated with burning, freezing, and topical medication without a problem. But people have to have exams periodically to be sure that they don't develop cancer, because the wart virus does cause cancer. Fiber. You can't talk about colon health without talking about fiber. And what is fiber? It's just carbohydrates that resist digestion in the small intestine. It's undigestible stuff. There's soluble fiber, which absorbs water and forms a gel. And it has a lot of metabolic properties. It can improve your lipid panel, improve your blood sugar, and it's good for people with irritable bowel and even with inflammatory bowel. Insoluble, that stimulates water and mucus secretion, so probably not the best for somebody who's got colitis. The fibers are listed as viscous, low viscous or high viscous, and the high viscous ones have laxative effects, the low viscous ones don't. Fermentability, all these get fermented in the colons, but the one that's fermented, the ones that are fermented on the right side will not reach the distal colon and do much, but there are plenty that do. So some soluble, high viscosity ones, like I already said, they can lower cholesterol. They're beans, legumes, oats, barley, psyllium, pectin, fruit, raw agar gum, many foods. Low viscosity ones are onions, garlic, asparagus, bananas, chicory, gum arabic, hydrolyzed agar gum, and some insoluble ones are cellulose, hemicellulose, lignin, and wheat bran. Now, this is what I got carried away with, the so-called hot topics. We've been talking about the others for generations. The inner world of the gut. The microbiota, and this is a real popular term now, are the microbes that grow in the gut. They ferment fiber and they produce butyrate, and we'll talk more about that. Butyrate, very important. The microbiome is all those microorganisms along with the genetic material, debris, metabolic products, everything that's in there. That's the microbiome. Now, butyrate. So it's produced by bacteria fermenting fiber, right? It's the primary energy source of colonocytes, the cells that line the colon. Now, that's really bizarre. All through our body, the fuel, the nutrition, everything comes from the blood supply. But these cells get most all of their energy from fermented products. And butyrate is a regulator of the gut barrier integrity, that wall between the bacteria and the body. It has immune function stabilizing. It reduces systemic inflammation. It has been shown to have some neuroprotective properties for Alzheimer's, Parkinson's, autism. In other words, good for the brain. It has positive effects on the metabolic part of the body. And when I say metabolic, I'm kind of referring to the whole thing of diabetes, lipids, that kind of thing. It tends to regulate appetite, improve blood pressure control, and we already talked about lipid metabolism. It's promoted by dietary intake of legumes. Beans are actually a power food. Whole grains, rice, oats, barley, cooked potatoes, bananas, apples, citrus, chicory. We talked about, it's basically the ones that we just talked about with the fiber on the previous slide. And it is recommended that people get 25 to 30 grams of diverse fiber. And it's kind of interesting. That's another thing, is they're talking about the biodiversity in the gut. That's a good thing. And our fiber being diverse improves the biodiversity of our gut microbiome. Leaky gut. Now, this is a little bit of a trash term to a surgeon, because when we talk about a bowel leak, we're talking about a hole in the bowel that you can see, and stuff leaks out, and within very short time you develop peritonitis. But that's not what leaky gut is referring to. And we have known for a long time that bacteria in the bowel can what we call translocate, where it can actually get through the bowel wall, the bacteria. Whole substances don't go through a hole, but microscopic things can go through. Bacterial products, toxins, bile acids, food antigens, bacteria in severe cases, that would be a sick person, can get across the barrier. And that can result in inflammation, metabolic disease, cardiovascular, renal disease, and some of the bad byproducts can even be detected in the blood. And I will just throw in here this idea of systemic inflammation. I mean, we're finding out that inflammation in the body is just involved with everything, all of our disease processes. So, what are you going to do about this? Diet, we already talked about diverse fiber. We talked about good foods to eat, complex carbohydrates. They can be soluble or non-soluble, as opposed to, and on the right-hand side, simple sugars and simple carbohydrates. The complex carbohydrates are going to be slowly metabolized, and they're going to give more even blood sugar trends, whereas the other stuff gives you a really quick boost and then a dip and insulin surge and all that. Plant-based protein, and I already told you beans, the superfood. beans, the musical fruit. The more you eat. So eat your beans for every meal. Raw nuts, they actually improve weight control. They improve lipid panels. Now you wouldn't expect that because they're fat containing. They improve cardiovascular measures, reduce cancer risk, specifically colon cancer, but other cancers as well. I'm just trying to emphasize colon. And they are not associated with weight gain. Red meat and processed meats are dose-related to cancer. The more you eat, the higher the cancer risk. Circadian rhythms. Circadian rhythms are the daily rhythms of your body. And I guess we have it in our planet, right? But every part of the body they've discovered has circadian rhythms. And you have a central area in the brain that's controlling circadian rhythms to a degree, and it's largely influenced by outside light. But you also have circadian rhythms in all the tissues. Even cells taken out and put in culture seem to have a circadian rhythm. And disruption of this rhythm tends to increase risk of multiple diseases. It's been studied that 7 to 9 hours of sleep each night is ideal. Going above that, the parameters start to fall off. Less than that, they're bad. It can be disrupted by shift work. I've had a little problem with my slides, but it can be disrupted by shift work, irregular or wrong sleep timing, irregular meals, light exposure at night. High-fat diet can negatively affect the circadian rhythms and the gut microbiome. Increases risk of colorectal, breast, prostate cancer when the circadian rhythms are disrupted. And it has negative effects on all the metabolic and cardiovascular type things. Exercise. It enhances gut microbiome diversity. And I'll tell you, the reasons for all these are quite complex, and I couldn't go into all of it tonight. I would have to do more study to even understand it. It promotes the beneficial bacterial strains, so it's anti-inflammatory. Interestingly, the muscles communicate with the body. They put out myokines, which are just chemicals, and those influence the gut and boost immunity, and that in turn boosts certain things that enhance muscle productivity and function. So it's like this cycle of positivity. It opposes leaky gut. We already talked about the improved gut barrier integrity, decreases inflammation, enhances gut circadian rhythms, and improves the metabolic panels, and things like reflux, IBD, IBS, constipation, definitely constipation, exercise improves. So this is just kind of a summary, and it might be too small for you to read. So a summary, I tell people this with a diet: eat regular meals. Try to avoid eating anything between meals, even good things. And I'll tell you a little bit more about that in a second. A high fiber diet we've talked about. Now I can't read it. Avoiding processed meat and red meat. 7 to 9 hours of sleep at night. Exercise. And exercise can be modified as you need be. I've heard people sadly tell me why they couldn't exercise. And I have 5 older siblings that all have impairments to their exercise, but they're all committed, so they make adjustments. If you are wheelchair bound and all you can do is this, if you set your clock and you do it for a certain number of minutes a day, your heart has been told they're exercising, and it begins to send out all these positive signals that says, hey, we're on an exercise program. So it doesn't necessarily have to be a strain on the back or the hips, the joints. I mean, ideally we get up and we do the great cardiovascular, but there are cardiovascular effects even from simple little things like that. Water is essential for processing fiber, and it's essential for combating constipation. So I recommend to patients drink 12 to 16 ounces of water first thing in the morning on an empty stomach before you do anything else. When you first start that, that'll be repulsive. Who wants to drink water in the morning? But when you get used to it, it's like the day's not right. And if you have a partner, a nice thing is your partner to say, hey, you want me to bring you your water, you know? And for me, I can't drink cold things fast, so I do it tap temperature. And then the rest of the day, it's good if you repeat that every afternoon. And then other water, but just start off with a devotion to that large dose of water in the morning. Sunlight, of course, affects vitamin D, is essential for vitamin D production, affects your circadian rhythm, helps to regulate it, positive effects on mental health, cardiovascular profile is improved, blood pressure, certain cancer risks is decreased with sunlight, and obviously other cancers are enhanced with sunlight, so you have to weigh the two. Moderation or self-regulation, regular meals, regular sleep, regular exercise, regular water. I mean, the colon just loves a regimen. Sleeping in the dark 7 to 9 hours nightly. And it's interesting, this information that I got, I didn't do it from any, what should I say, hobby papers or anything like that. I used an AI program that is for licensed professionals. You actually have to give them your provider number to access it. And believe it or not, this idea of spirituality and religious practices has been studied. Now, one thing I didn't have a chance to research is what we call the quality or the level of the data. It could just be small studies or it could be big. So I can't tell you that for sure. But the studies that they were looking at, this is a dose dependent, and when I say dose dependent, I mean the greater you do it, the more effect you see. Like they measured the number of times, you know, the frequency that people attend church, that kind of thing. And why this is true, some of it could be community, belonging, having some sort of mission, hope, faith. And we do know that hope is pretty much essential for survival. I mean, you know, if you've read any of the Holocaust stories, they will tell you, you know, it's the people that had this hope and determination that survived, and there were other people that were much healthier than the people that came in with them, and they died quicker because they just, you know, there was none. There was one little thing I wanted to talk to you about. Let's see, going back. Oh, well, I said the regular meals, and I tell people regular meals, nothing in between meals. We tend to not get hungry. We tend to be bird eaters, right? I mean, food is just so available to us. It's so easy, but it's not good for the colon. It tends to constipate the colon. We have a gastrocolic reflex. So when you get hungry and you're very empty, and then you fill up your stomach, it tells your colon, whoa, get up, wake up. You know, we're going to be working today. And if you do that at regular times, then the colon is more obedient. And yeah, it's just another one of the things that the colon loves regimen. But eating in between meals really disrupts that and leads to constipation. And then I tell people a handful of raw nuts daily, good for the brain, good for the heart, and good for the colon. And that's pretty much it, I think. I don't think I have anything else. Any questions? Yes?
And yes, I'd like to know more about the fiber, the soluble versus not soluble.
You know, I tried to boil it down, and it got more complicated the more I tried to boil it down. And so what I kind of decided was, if I just kind of outline some terms, it gives you something that you can look at. You know, you can understand what fiber is. Fiber is something that's non-absorbable, so it's going to make it to the colon, right? And once it gets to the colon, it still gets processed because it gets fermented by bacteria. And some things still get absorbed, but other things just form fermentation products and then stool, and that's it. So the soluble fiber, really the only definition is one dissolves in water and the other doesn't. And with the one that dissolves in water, it forms kind of a gel matrix. And so its properties, let's go back. Let's see if I can sort through. Yeah, it's got a high water holding capacity, and obviously to make soluble fiber work, you're going to have to drink plenty of water. Because when your body is dehydrated, you decrease urine, right? I mean, you have hormones that cause your kidneys to quit making as much urine, because the main thing is you got to keep your brain and heart going, right? Those are the two things that the body's going to preferentially preserve. And the other thing that's under the influence of hormones is the gut. So if you're dehydrated, the gut is going to absorb more water back into the body so that it can feed it to the bloodstream and keep your heart and brain going. So unless you have plenty of water so that your gut doesn't have to reabsorb too much, you're not going to have that water there to bulk up the soluble fiber. The insoluble, some sources say it rubs the wall of the gut. And if any of you are into, there's a guy named Stephen Gundry that puts a lot of stuff out. You see it on Facebook all the time. And he, by the way, has no background in nutrition, but anyway, he tells you that, you know, wheat bread is bad, tomato seeds are bad, all these kind of things. And he probably, I'm guessing, bases it that they have some insoluble fiber. So he thinks it tears up the bowel and causes leaking. And, but some of this, I mean, you have to look at the overall thing and look at it yourself, and whether you can believe that white bread is seriously better for you than brown bread, and that tomatoes shouldn't be eaten, that kind of thing. The interesting thing about Gundry is that he was a cardiothoracic surgeon at Loma Linda, and that's where I trained. And so he's influenced a lot of people there. But the only blue zone in the United States is Loma Linda, California. And so I know a lot about what the blue zone people do and eat, because I kind of grew up in that culture. And I assure you, these people that are living to 98 are eating plenty of brown bread and plenty of tomato seeds. So, but it is very confusing, the different types of fiber. It really is.
Basically, like a variety is best, right?
Yeah, the variety, I mean, from what I glean, the variety is, the variety in fiber creates a variety in the bacteria, and the bacteria are good. There are no good viruses, as far as I can tell. But bacteria, we've got good and bad. And in the right place, a lot of them are good. Yeah.
I was just wondering about, we were talking about the benefits of the diversity of bacteria. What is a good way to repopulate your gut bacteria if you've been on antibiotics?
Well, some people say taking probiotics helps. I mean, there are some studies indicate that they help. With time, a lot of it's going to build back up. It's, you know, enemas from a trusted friend, I wouldn't recommend that. But, you know, the actually stool enemas have been used for severe colon compromise from antibiotic colitis. It was miraculous when it was developed. I mean, there were people that just, it can become a deadly condition. We're doing better managing it now without that, but.
You mentioned some foods that were really good for many things, and I didn't get what kind of foods they were.
Beans of all kinds are a superfood. They have fiber, they have protein, and then, you know, the vitamins and minerals. Now, some people are concerned when they go with, okay, let me finish this, I'm sorry, I derailed myself. So beans are superfood. All your legumes, you know, red beans, black beans, pinto beans, lentils, all that. Nuts are very good, raw nuts. They lose some of their benefit when they're salted, roasted, that kind of thing. And then, you know, all your vegetables is where you're going to be getting, you know, a lot of antioxidants and vitamins, minerals.
Also, I got some yogurt recently that said it has both prebiotics and probiotics. What does that mean? Prebiotics.
I actually don't know. I have recommended yogurt to people, you know, when they've taken antibiotics, try getting yogurt with active culture in it. The problem with the probiotics and with yogurt is that your upper digestive system does a really good job of tearing down the bacteria that you swallow.
All the good bacteria. Oh.
Yeah, it's hard to get it colonized down there in the colon because, yeah.
My husband had pneumonia. At the hospital, I don't know the type of antibiotic they gave him, but he was put in Northbrook. It caused C. diff, which is so contagious. My gosh, it can live on counters for 6 months or something. And he was in isolation almost the whole time he was in Northbrook because it was caused by the antibiotic.
Yes, it's the biggest, and we have what we call antibiotic stewardship, where hospitals have to monitor the antibiotics they use. I feel like we use too much a lot of the time. It's really hard. It's a hard trade-off. But yes, that is the feared complication of antibiotics. So, you know, we're not afraid in our current environment. We tend to be very, very afraid of vaccines, and I don't want to get into that a lot, but we're not afraid of antibiotics, and we need to be. We use them when we have to. I mean, I would take it in a heartbeat if I had something that needed it. You know, I tend to think that kind of balancing and moderating things, and I see a lot of people that are really, really obese, and to advise them to go on a rigid diet and don't eat any of this and eat this and this, it's guaranteed failure, you know. And I tell people, start learning about, just start investigating, doing your own study, figuring out things that are good. And instead of forcing yourself to eat what you don't like, there's enough stuff out there that you'll like some of the good stuff. And emphasize that in your diet. And some people may be able to just cut out bad things, but other people need to emphasize good things and figure out what they like. Because you might discover something that you're really fond of is actually a great food. So, and for me, when I was growing up, I didn't like beans at all. I didn't like the smell of them, didn't like the taste of them. I love them now. And it isn't because I was brainwashed. I started liking them before I learned about their positive properties.